My name is Dr. Cathy Craven. I am a physiatrist or a specialist in rehabilitation medicine. I work as a clinician scientist at Toronto Rehab, and I have an appointment in the Department of Medicine at the University of Toronto. My clinical and research expertise is in the management of secondary health complications of spinal cord injury. I have a subspecialty interest in understanding how changes in muscle and bone affect patient health, and I also have a little bit of a focus in health services. I have some primary research that's looking at changes in muscle and bone, and particularly looking at if we can develop interventions for people who cannot exercise for themselves, so those with motor complete spinal cord injury. And related to my Rick Hansen Institute-related research, I am helping to lead the Escan project, which is essentially a look at the capacity to conduct spinal cord injury rehab in Canada. Well, the Escan is national in scope, so one of the challenges, and I think the strength of the project, has been the engagement of 15 rehabilitation tertiary rehab centers across Canada. So having that engagement has been very important. So Escan is a interesting marriage of looking at capacity in terms of staffing ratios, capital equipment, what's in the environment. It also includes an audit of research and clinical resources, and it includes identification of what we call spotlight best practice organizations, which is where there are pockets or excellence or standout centers that are really doing or providing exemplary care for patients with spinal cord injury. So the focus of the Escan is about trying to provide a snapshot of what care for spinal cord injury looks like in Canada today, with the aim of characterizing it before some of the other RHI-funded initiatives like the Knowledge Mobilization Network or the Best Practice Implementation Project are rolled on top of that so that we can measure how it changes. So what's unique about the Escan is it really works hard in trying to explain the processes of rehab and explaining how rehab is customized to the person and their impairment. So that not only do we look at whether a person has paraplegia or tetraplegia, but we also look at them in the context of where they live and their social setting. So obviously, the care needs and goals and objectives of a single mother with 2 young children at home would be very different than an elderly man with an established business who both have the same impairment. Their goals and priorities and what things they would want to get back to in the community would be very different. So the Escan tries to, through a framework, show how goals for patients related to their impairment, but also in terms of getting them to address their disability and handicap, getting them back into the community, into their roles, so into parenting, returning to employment, becoming sexually active, doing those meaningful things that are part of the rehab process. We've tried to put a model that explains how we customize care for individuals, because I think a lot of people don't wholly understand what rehabilitation is. And then what we've tried to do is, within the model, break up each of these rehab goals into tangible things, optimize bone health, maintain skin integrity, just as an examples of they're very specific objectives. And then we've tried to describe what is the current spectrum of services that are currently available related to that particular rehab goal. And at the end of each chapter that talks about each individual rehab goal, we have a report card. And the report card is the sort of saying, where are we at currently in our capacity in terms of knowledge generation or clinical capacity or policy? Because what we found as we did the Escan was that there are many different barriers to practice implementation or offering best practice, and that sometimes there are different solutions for different problems. So what the Escan has to offer in spades is a template for what do we need to do to dramatically change care by 2020. So in the end of each chapter, there's a report card that may say, okay, this is an area where there's excellent research, where we have an identifiable clinical standard, but there are actually health policy barriers that are precluding delivery of the best care. Or in other areas, there may be, it makes the point of, oh, this is something that actually we need some research because we don't really understand what's the right outcome or what's the thing we need to do for somebody. Or in other cases, it may be that we have the clinical capacity, we know the evidence is there, we know what's the right care to provide, but perhaps centers don't have access to the equipment that they need. So the Escan provides a report cards on a variety of barriers to practice implementation. And I think the results of the Escan, in particular the report cards, can be used to facilitate practice change by a number of stakeholders. So by clinicians in terms of looking at established standards and foci of best practice through these spotlight organizations, or through, if you're a government agency or an NGO, that you could look at what are the policy barriers and try to facilitate change through policy change. And then we have also mapped out a very interesting research agenda that relates to frontline patient care. So I think those are the takeaways from the Escan. I guess one thing that's very interesting in the Escan is we have some foci of absolutely excellent, head and shoulders above everyone else care. But we also found a lot of regional disparity and inequity that really needs to be addressed. And the other thing that was very interesting to me as a clinician personally was the Escan highlights a lot of areas where practice is redundant or ineffective, and that not only do we need to change and start doing new things, but we have to stop doing ineffective things too. And I didn't really come to the project with that perspective. So to me, that's been a sort of important take-home message of we've got to stop doing the things that really aren't important and don't work and start doing the right things with the right tools. And the Escan really provides, I think, a very nice blueprint for where do we need change, in the hopes that different other groups and related organizations will help us to move that agenda forward and hopefully change care for patients living with spinal cord injury. I think one of the benefits of the project has been the engagement of the tertiary academic rehab centers, where we had a group of rehab service providers actually all working together on one goal, which is quite unique. And what has happened through the process of Escan is that we've identified that it's not just the tertiary academic rehab centers that are providing spinal cord injury care, and that we have other partners that we need to engage on the go-forward basis that we didn't even really recognize existed before we started the Escan. So to me, that's been a very interesting insight, I guess.